We have this weekly series that we started, and we're in the middle of it. And last week, we talked about the Empatica Embrace watch. It was a wristwatch designed to predict seizures before they happen. So each week, we want to bring on a new product. So Dave Barnes, a digital health consultant, is with me. Dave, what are you going to wow me with today?
Ben, today I'm going to wow you with, I want to talk about something that's on every parent's mind when they send their son or daughter out on the field to play sports.
Dude, I have 2 kids, right? So I have a son who played baseball. I had a daughter who did theater, so it's not the same kind of thing. You're not going to get hurt doing it. But my son, every single day, I worried about him.
Every parent worries about concussions, and it's taken a long time and a lot of research hours to draw a conclusive link between the data and long-term damage to the brain, especially in kids. But clinicians are making new discoveries every day that shed light on the really important issue.
So Dave, why is it changing? When I was a kid, I bumped my head all the time when I played sports, never heard of the word concussion. Now it's everywhere. What's changing in the diagnosis? How do we know it's happening?
Well, I think there are 2 things happening. One is the perception of what's happening. It used to be that there are plenty of sports like football where that's what the concussion discussion started. But now that clinicians are looking at sports like soccer, field hockey, wrestling, where there's an opportunity for head contact, but they're not wearing helmets to play it.
So, all right, I gotta jump in here because,
Sure.
We've already been talking about this and we're sort of teasing the audience, right? We had our last guest on. We talked about a LiveCore. It's a device you go out, help you tell what your heart rate is, ECG, really, really important. What's the product, Dave?
Well, there are a couple products out there, and they're essentially designed to look at the impact to a head during a sporting event. And there are a couple that I wanted to talk about. One of them is the new device called the Jolt sensor.
What's it cost?
$99. You can order it now. It was developed by a former MIT wrestler who experienced a concussion during practice. It looks like a small money clip that's made of rubber. You can clip it on any headband. So it's small enough that you can clip it on the inside of a helmet for any sport. Another device is called the Reebok Check Light. This one's a little more expensive, but it's a collaboration between a company called MC10 and Reebok. This is sewn into it's like a silk helmet liner that you put on your head, and it senses when the head has had a serious impact.
So if I'm a football player or a lacrosse player, I'll be wearing it while I'm out there participating?
Sure. Either one. You could clip in the helmet. You could put the check light on and put your helmet on top of it. And the last one was more of a specific for football. It was made by the helmet manufacturer Rydell. And this is called the Rydell. It's an impact response system. And it's a football-specific technology.
All right, give me one tip on each product really quickly, Dave, because we're about to end our session.
Jolt, it's small and clip-on. You can wear it adapted to any sport, from soccer to boxing to field hockey. It's small and portable. The Reebok system is fantastic. That can be easily worn underneath a helmet for like hockey, baseball, lacrosse. And the Rydell system is excellent for football. It's a specific football device made by one of the leading suppliers in the sport.
Dave, give me one piece of advice that parents can do to help their kids with safety.
Sure, Ben. Get involved. Ask your kid's school, the administration, or your sports academies what they're doing to support head safety. Educate yourself, educate your kids on concussion research, and then go buy one and wear one.
I recommend it to everyone. If you have kids, you do not want concussion, and we need to do something about it. It is an epidemic in this country. Dave, thank you for sharing that.
Thank you,
I am Ben Chodor. You've been listening to Health Tech Talk. I need to take a commercial, but I want to remind everyone and thank everyone at 1-800 Public Relations for all their media and PR support, and, of course, everyone at Stream VPG, especially John in the booth. John, thank you for all your help. We'll be back after these messages from our sponsors.